Now, in this video, let's also talk about who should not drink coffee. Coffee is one of the most widely consumed stimulant beverages worldwide. It ranks among the top 3 most consumed drinks globally. Filter coffee, in particular, is known to be highly protective for cardiovascular health, liver health, and many other metabolic diseases. Yes, we are very clear on this point. However, not everyone can drink coffee. Why do I say this? Because coffee can cause side effects in some people. In this video, I will talk about 10 conditions or diseases in which coffee should either not be consumed or should be limited. Let's begin. Point 1. Irritable bowel syndrome, IBS, also known as irritable bowel or restless bowel syndrome. In these individuals, coffee can significantly affect bowel movements and may trigger constipation or diarrhea attacks. Yes, this is true. People with IBS should consume less coffee because it can alter bowel motility. 2. Arrhythmia, heart rhythm disorders. Normally, coffee does not directly cause rhythm disturbances. However, if you already have an underlying rhythm problem or a predisposition, coffee can bring it to the surface. Coffee is not the cause, but it can accelerate the appearance of an existing problem. If you experience palpitations or rhythm disturbances after drinking coffee, this suggests that your coffee tolerance is low, while the general daily caffeine limit is 400 milligrams. People with rhythm disorders are advised not to exceed 200 milligrams per day. We strongly recommend that patients with arrhythmia do not exceed 1 large cup of coffee per day, if possible. 3. Pregnant women. Regular coffee consumption during pregnancy has been associated with low birth weight and preterm birth. Pregnant women can consume coffee as long as their daily caffeine intake stays below 200 milligrams, but they should definitely not exceed 1 cup per day. 4. Breastfeeding women. Women should also avoid excessive coffee consumption because caffeine passes directly into breast milk and can affect the baby. The same applies during pregnancy. Caffeine consumed by the mother can pass to the baby. Therefore, coffee intake must be limited. 5. People with sleep disorders. Coffee can trigger or worsen sleep problems. Especially consuming coffee after 6 p.m. can cause difficulty falling asleep, reduced sleep quality, and delayed sleep onset. People with sleep disorders should limit coffee intake and avoid coffee completely after 6 p.m. 6. Individuals under 18 years old. Children and adolescents are more prone to rhythm-related problems. Therefore, their daily caffeine intake should be below 200 mg. As a reminder, under 18 years old, max 200 milligrams per day. Adults 18 plus, max 400 milligrams. Day 7. People with panic disorder. Studies have shown that coffee can trigger panic attacks in individuals with panic disorder. 8. People with anxiety disorders. Low doses of coffee may reduce anxiety, but high doses, especially above 400 to 600 milligrams per day, can worsen anxiety symptoms. In mental health conditions, the most important factor is dosage, and coffee should be carefully limited. 9. Gastroesophageal reflux disease, GERD, commonly known as reflux. Coffee can trigger reflux attacks by increasing stomach acid secretion. Therefore, individuals with reflux should reduce coffee consumption. 10. POTS syndrome. Postural orthostatic tachycardia syndrome. People with POTS are often more stressed and may have low daily fluid intake. When standing up suddenly, they can experience palpitations, blood pressure drops, and dizziness. High caffeine intake can trigger these symptoms. Therefore, individuals with POTS should consume caffeine in limited amounts. Summary. Although 400 milligrams of caffeine per day is considered a general limit for adults, in the groups I mentioned, intake should be 200 milligrams or less, and in some cases, coffee should not be consumed at all. Coffee is indeed a healthy beverage, but it is not beneficial for everyone. Coffee is only beneficial for the right individuals. Not everyone should consume coffee regularly. How much coffee do you drink per day? Let's meet in the comments. For now, goodbye. Stay healthy.